Hey, Manual Therapy friends, it's Dr. David here with your Research Review Monday. We've got an article from Spain here, and it was published just a year ago, May 2019. Can you believe it's already halfway through 2020? It's been a fast 2020, crazy 2020. But anyways, the article here is called Physiotherapy Based on a Biobehavioral Approach with or Without Orthopedic Manual Physical Therapy in the Treatment of Non-Specific Chronic Low Back Pain, a randomized controlled trial. And now what they were doing here, they had 50 people and they split them up into two groups, 25 in each group. They were trying to find out if the addition of orthopedic manual physical therapy changed the outcome as far as people's pain. And so if I go down to the interventions here we are. All right, so the control group, it's this paragraph right here. They had a bunch of education, PowerPoint presentations, diagrams, images, text about how they saw pain, how they interact with pain, how to become more aware of their pain and being able to move with pain. They had exercises as well, but they did not have orthopedic manual therapy. And then in the experimental group, it was everything that the first group got, the control group, but now they got, here in pink, manual therapy, which there was a protocol that consisted of, let me read it to you here, accessory mobilizations, postero-anterior, traction of the lumbar spine, mobilization with movement of the coxofemoral joint, which is the hip, and global techniques of neural mobilization of the lumbar spine. And what I wanted to highlight here, so the results showed that there was no difference, that manual therapy had no significant difference in the short term or the medium term is what they called it, as far as improving the patient's pain. And I love this study because, I always question the manual therapy techniques that were done. And, here they're talking about postero-anterior accessory mobilizations of the lumbar spine. So basically they were doing P to A's, maybe kind of at an angle to make it, a little different angles at the lumbar spine. But to tell you the truth, I never do posterior to anterior mobilizations. I shouldn't say never, maybe once a year. It's extremely rare. Most patients are way too lordotic and they can't really flex in their lumbar spine. So we don't want to push them into more extension by pushing P to A on a lumbar spine. I question the validity of the manual therapy techniques done. Traction I could see, mobilization with movement of the hip I could see, but I still wonder how well they're firing their abdominals, how well they're stabilizing with their glutes. There's so many things to look at as far as the manual therapy section of this study. I would love to see it exploded better, or maybe even see like a treatment note for a patient to see all the techniques that were done, or some video or images too would be fantastic. But I have to just disagree with this study completely, especially since I'm a manual therapist and I see people with chronic low back pain all the time. When I see them get way better, I'm just shocked that they didn't have an improvement. But I have to put it on that they didn't have the best kind of manual therapy that they can get, or even they probably just had a mediocre amount of manual therapy. Anyways, besides the point, the other topic that I wanted to hit on is how they're talking about pain to the patients. Because honestly, when I get a chronic pain patient, I just concede that they're going to be in pain, and I flat out tell them that I can't fix their pain, that I'm not here to fix their pain. I'm here to improve their function, which they look at here in this study. They looked at a bunch of different what are they called? The questionnaires. Like right here, it says global perception of change, self-efficacy, pain catastrophizing scale. They used all these different scales. The Tampa scale of kinesiophobia, low back pain disability index, the Roland Morris disability questionnaire. So it's all about pain and function. But I just completely focus on function because pain is so subjective. It can be influenced by so many things outside of mechanical problems that physical therapists hang out in anyway. So when I get a chronic pain patient, we rarely ever talk about pain. We don't get numbers, 0 to 10, what's your pain today? We are not doing that every day, because then they just focus on that constantly. And even if you tell them not to focus on pain, as soon as you say the word pain, they just think about their pain. Even if you say, don't think about pain, you think about pain. So we just eradicate the word pain from treatments here whenever they're coming. Really, most patients, we don't ever talk about pain. And nobody talks about pain, not our front desk, not anybody answering the phone. We just minimize pain big time. And what we focus on is what can you do that you couldn't do before? Because that's ultimately that matters. Can you sleep better? Can you stand and walk better? Can you take care of your house better for longer periods of time? That's progress. Because most of the time, they only studied this for a month. It says here they had 8 treatment sessions for 1 month. So they went in for twice a week. And we never see people that short. I mean, it's rare. We do occasionally, but typically our treatment plans for chronic low back pain are 2 to 3 months plus. So it's just not enough time to go through all the changes necessary to effectively treat a chronic back pain patient. So sorry, I had to go on a little bit of a rant with this. I think it's so appropriate though, because if you're out there and you're treating chronic low back pain and you're thinking about using manual therapy and you come across studies like this that show that, let me show you in the abstract, the results section, does not increase, orthopedic manual physical therapy does not increase the effects of a treatment based on biobehavioral therapy in the short or medium term. They did admit it though. They said the results should be interpreted with caution. So that's what I'm doing. I'm interpreting it with caution. Anyways, let me know what you think about treating patients with chronic low back pain using manual therapy techniques and interventions. I'd love to hear if you're successful or not successful. If you're not successful, tell me your thoughts. If you agreed with this study, I'd love to hear it. By the way, I never intend to get into a professional argument with you on any of these videos or in the comments sections. I want to keep it positive, and I'm all about seeing the other side of things that I wouldn't necessarily agree with, and I'll respectfully disagree with things, and you can too. That's totally fine. So don't be afraid to chime in and give us your 2 cents. I always have something to learn from everybody, so I hope that you share the same sentiment. Anyways, I hope this was helpful. Have a wonderful Monday. Bye-bye.